it's Tim from ChiroUp, and today I have a quick video to demystify what Modic changes are. These were first described by Dr. Michael Modic. He was a neuroradiologist at the Cleveland Clinic, and he observed there was a fairly predictable pattern of MRI changes in people who had lumbar spine problems. He classified them into three categories. Modic 1 means that a T1 image shows a hypo-intense lesion, and T2 is a high or hyper-intense lesion. Modic changes 2 mean both T1 and T2 show a hyper-intense lesion, and Modic 3 means that the MRI shows a hypo-intense lesion on both T1 and T2. Now, what's that mean? It means that you go from a normal vertebra into a type 1 where the vertebral end plate and the adjacent vertebra become inflamed. It then can transition into a type 2 where that inflammation is replaced by fat. And finally, it transitions into type 3, which we often see in our office. That's where things have started to become sclerotic, degenerate in the body's attempt to stabilize the process. This process involves the vertebral end plate, the nucleus, and the annulus. Remember, that's three components that allow this to be a shock absorber. That end plate is also porous. It allows for transmission of loads, and the loads come from the nucleus in the center. That nucleus is very viscous. In fact, when we dissected one a couple of years ago, this was a porcine vertebra, we see that that's very epoxy-like. It's a gel. It's very viscous. And it's nowhere near the red stuff, meaning that nucleus has not seen the blood supply. It depends on getting its nutrients through the end plates. Those end plates, yes, they absorb shock, they bow. In fact, when we dissected this one, you could push on it and it felt like a bunch of trampolines put together. But those trampolines allow nutrients to pass through. That's how the nucleus stays hydrated and gets its nourishment. Well, over time, as those end plates become traumatized and they begin to crack and calcify, there's less nourishment, and that's how degeneration happens. It's like an old trampoline in your yard that started to dry out. You start jumping on it and it starts cracking, except the body heals that with sclerosis, which then causes problems. We can also see sometimes that jelly can begin to cause microfractures or crack the vertebra. If it fully cracks it, it turns into a Schmorl's node, which means you've punched a hole in the top or the bottom of that end plate. But other times the jelly can just leak in. Have you ever wondered how jelly can actually leak into a vertebra or punch a hole in a vertebra? That was a very viscous fluid. Well, a couple of years ago, Newell did a study and determined that the nucleus is called a non-Newtonian fluid, meaning it has the ability to change its stiffness based upon load rate. If it's loaded slowly, it's very viscous. If it's loaded quickly, it becomes very firm, like a rubber ball. The way that you can test a non-Newtonian fluid at home is by taking cornstarch and water. When you put those two together, as we have in this example, you can see that if you move slowly by just pulling the fork out of this syrup-like mixture, it pours like syrup. But if you load it quickly by taking this sharp fork and stabbing it in, it becomes a rubber ball. That same thing happens to the nucleus. So when you jump off the bed of a truck, you punch a hole in the bottom of the vertebra with a Schmorl's node, and when you sit all day in a flexed posture, that jelly wants to migrate backwards. Those changes as that jelly starts to migrate through that vertebra cause inflammation, and it causes irritation, which changes to Modic changes. These are the Modic classifications. This is an infographic that we use to be able to educate patients when they're concerned about what's happening, and more importantly, to let them know that yes, these are pathoanatomic symptoms. Your problem is coming from the underlying cause of what triggered that, and that's something that we can fix even if you have degeneration. If you'd like that infographic, check out ChiroUp.com. Go to the forums library. Subscribers can download it anytime. If you're not a subscriber, we would welcome you on board. Check out the blog. There's more detail for that one. If you have any questions, hit me up, Tim at ChiroUp.com. Thanks for watching.